All right, good morning, everybody, and welcome to the second installment of California Department of Aging's Ensuring Equity in Aging webinar series. Today, we are going to focus on culturally informed policy and programs with and for people with disabilities. Go ahead and next slide. So today you can join us by audio or of course here on Zoom. And we do have live captioning through webinar available. So go ahead and you can click that CC button at the bottom of your screen. We are going to record today's presentation. We will post the recording, the slides, and the transcripts on CDA's webpage. We have an Equity and Aging Resource Center available online, and you can find the link to that there. We also will post the video or the recording on our YouTube channel. Next slide. So we will reserve time for questions and comments at the end of this presentation, although we do also use this the chat feature in Zoom. So please go ahead, if you're on Zoom, go ahead and enter in your questions as the presentation goes on. But if you're joining us by phone, we will share the questions and comments instructions later on when we have that question and answer period reserved at the end. You'll just have to press 9 on your dial pad and we'll let you enter a Zoom audio line. And if you have any additional information or questions, feedback you want to give us, you can always send us an email at engage@aging.ca.gov. Next slide. And I want to remind you that we have some upcoming webinars. We're going to continue to do these every first Wednesday of the month for several months moving forward. We'll always focus on state and local speakers with expertise in the subjects of cultural competency, equity, program and service delivery that is suited for several communities across California. And our upcoming webinars are January 6th, Culturally Informed Policy and Programming, the Culture of LGBTQ Older Adults, and then February 3rd, Culturally Responsive Services and Programming with and for Black Elders. You can go ahead and register for those. We have them up on our Facebook page. We have them on our website. We feature them in our newsletters. If you want to receive our newsletter, you can go ahead and email that engage@aging.ca.gov email, and I'll sign you up. Next slide. And I'm going to hand it off to Kim McCoy-Wade, the Director of California Department of Aging.
Thank you, Amanda. I'm so glad to be with you all and with this terrific colleagues and leaders, Christina Mills and Anna Acton. I have the wonderful privilege of introducing them and then getting out of the way for this conversation to take place. I just want to provide a little bit of context. As we've been doing the Master Plan for Aging, a number of great conversations have emerged around disability and inclusion and equity. And no better folks than Christina Mills and Anna Acton and their networks have been at the table to help us in asking and addressing and advancing on those questions. So let me just tee up a couple of them. It's far too much for Christina and Anna to cover in an hour. So no, this is one part of an ongoing work together to strengthen our aging and disability partnership and progress. So one of the questions that came up from the very beginning on Master Plan for Aging was, is this a plan also for disability? And we really wanted to be sure from the beginning, the value of inclusion, that absolutely a Master Plan for Aging both includes people with disabilities as they age, and also includes that part of aging for many people is acquiring disabilities of some kind. And so how do we bring that front and center and make sure that's inclusive? A second question that came up early in the process, and Dr. Fernanda Torres-Gil from USC was very helpful in articulating the special interaction and relationship between ageism and ableism, and how there is an intersection that Christina and Anna, I'm sure we'll talk more about, that we all need to be aware of. People who've been working in aging may have blind spots around ableism, and that's probably a language choice that I just used that reflects that. And there are people in the disability movement who may also have an ageist biases that we've all acquired by growing up in this culture. And so really being aware of the ageism and ableism opportunities and intersection. And then thirdly, I think as our equity work group really dove in, and I want to thank Marielle Creasel from Disability Community Resource Center for really helping bring forward, of course, the diversity within disability and the intersectionality around disability and LGBTQ, disability and race. Alice Wong has also been an enormously influential thinker and leader in this space and helping us make sure disability visibility is truly inclusive. So with just those three small questions, we have no better people to help inform us, advise us, and do better together. Christina Mills, I think many of you know, has served as the executive director of the California Foundation for Independent Living Center since 2017, but has more than 20 years of disability rights and independent living center services experience. There's so much Christina has done as CFILC, but a couple things I want to really lift up: her work in disability disaster access and resource program, her work in bringing together aging and disability around ADRCs, Aging Disability Resource Connection, and her work, I guess it's tomorrow, Christina, in bringing together aging and disability for a joint conference. So really appreciate her service in the Master Plan for Aging and that 20 years of experience. And then Anna Acton, Executive Director of the Freed Center for Independent Living in Nevada County, over 15 years experience in this space. And to be clear, not just Nevada County, Yuba, Sutter, Colusa, and Sierra. Has been a tremendous leader in thinking about disaster services again, and also about rural communities, making sure that the Master Plan for Aging includes all communities as well. So thank you to both Anna and Christina. And with that, I will turn it over to you.
Thank you so much. This is Christina Mills from the California Foundation for Independent Living Centers, and just want to really highlight the wonderful partnership that we've had, both disability and aging coming together with Kim's leadership at the Department of Aging, and really bringing the communities together in ways that we've never experienced before in California. And I think that her leadership really has moved that forward in a very positive direction. I'm with the California Foundation for Independent Living Centers. I think a lot of you are familiar with our organization, but we are the membership association for California's independent living centers. We are not an independent living center. We serve as the association. Living centers pay membership to us once a year to be their policy voices, their policy arm in Sacramento. And in addition to that, we run a number, 6 to be exact, statewide programs. Some of you are familiar with us through those programs, whether it be the Ability Tools program, the Digital Access Project, Yo Disabled and Proud, the Disability Organizing Network, Freedom Tech. Oh my gosh, I'm forgetting some of them. And of course, our newest program, Disability Disaster Access and Resources, which has been an exciting program that we've taken on this year that really was much needed and continues to evolve, certainly in a variety of areas. I'm excited to be presenting this topic today, and just want to say that usually this is a very important topic to me that is super important, and I'm completely passionate about it, and it typically takes about a half day or a full day to go over it. So doing it in an hour is definitely going to be challenging, but if there's a need to come back for a part 2 or a part 3, we're happy to do that. And with me, introduce my co-presenter and my friend and past chair, Anna Acton from Freed.
Thank you so much, Christina. This has been quite the year. We have had so much work around disability and aging with the Master Plan on Aging and other community efforts. Freed is one of 28 independent living centers in California. We are peer-driven organizations that provide a whole variety of services for people regardless of type of disability that the person has or regardless of age. So we span throughout the entire state, and we are also a member organization of CFILC. So with that, we're going to move to the next slide. As Christina said, we are really passionate about this topic. And so we could spend all day, and we're going to try to cram it into an hour. So I'll just get started on this slide and then hand it over to Christina. So we wanted to just kind of ground ourselves a little bit in the independent living and disability rights movement. This movement really started in California, and it's really part of the larger civil rights movement that we saw in the start in the 1960s. Really began in Berkeley with the first ever independent living center in the nation in Berkeley. There was a gentleman by the name of Ed Roberts who wanted to go to college and went to advocated to get into Berkeley. He had contracted polio as a kid, used a wheelchair and iron lung to breathe, and wanted to go to college. He advocated for access to college, and they started a group called the Rolling Quads there on the Berkeley University. And that movement really was a peer-driven, let's get together, we can relate to one another. And they started not only advocating for access to the college, where we see the first disabled student services program, and then really be responsible for that. And now we see that in every college. And then start realizing, you know, we want to have better access to the community. They actually developed the first curb cuts in the nation there in Berkeley, and got together to envision a peer-driven support system so that people with disabilities could live, work, and play in the setting of their choice. So Christina.
Yeah, I think I just want to point out, in addition to that, that our movement was really based on us being empowered to self-advocate and be able to have the ability to make our own choices and have respect in making those choices. So was what the intention was in the beginning. I'm sure that a lot of you are thinking in your head, that's still probably the intention today, because it is. A lot of us still don't have the choices that we want to make for ourselves. And a lot of people with disabilities still don't get the equal respect as their non-disabled peers. So that continues to be among our values, and self-advocacy is probably the most important advocacy and systems change advocacy, one of the most important priorities in service independent brings and is uniquely known for, because not only are we providing services from a peer-driven model, our federal funding that comes to centers requires us by law to have 51% of our staff and board members be people with disabilities. And when I say people with disabilities, and Anna says that, I think it's really important for everyone to understand that we're coming from a place that disability to us is the gamut. It's diabetes, it's visually impaired, it's deaf, it's hard of hearing, it's mobility, it's chronic illness, it's anything and everything you can imagine that affects your daily living situation. So while Anna and I have certainly had some very interesting experiences during COVID, one of them that we could very interestingly relate to as we were putting together this presentation was that as wheelchair users, both of us have experienced respect in a very different way over Zoom, in the way that we've communicated with folks that we've never known before throughout COVID, because people can't see our wheelchairs. And having people that don't know us personally talk about people with disabilities in a way that they absolutely would not talk about people with disabilities, us, if they had seen our wheelchairs necessarily. So it's been a very interesting situation. From there, though, let's go on to early messaging. And I just want to set the tone by letting you all know that we requested that CDA turn on the chat feature today, because we want this to be interactive. And we know that some of these questions that we're going to ask might make folks feel uncomfortable, and that's totally okay and normal. We want this to be a discussion that really brings people to a different place in terms of understanding disability, understanding ableism, and why our society is the way it is. So to start that, these are some of the easy questions to get us going. And we hope that you do participate with us. But some of the early messaging of disability, and the reason why we wanted to really set the foundation by asking you these is because you can imagine from a disability perspective what the messages here might make you feel like or react based on disability. You were born with a disability, acquired a disability, or you were aging into disability, what those experiences might feel like based on the early messaging of disability. So let's just start by saying and asking you all, where did you first hear about disability? And while you're answering those questions in the chat, the difference between Anna and I is that I was born with my disability, and Anna was, she acquired her disability in her teen years. So Anna, as a person that acquired her disability or your disability, what were your early messages before you became disabled?
Yeah, that is a great question, Christina. I actually feel like I am really fortunate. The only person that I can think of that I knew that had a disability was a neighbor of ours and friend of my parents. His name was Sam Dardick. He used a wheelchair. He had polio as a child and used a wheelchair. Now, this gentleman is was building his own house with his own hands, raising a family. And so when I became disabled in my teens as a freshman in high school, he was literally the image of disability that came to me. But that is a really rare answer, I would say. So he really became this role model that, well, I am able to do anything that I could do before. I can raise a family, I could build a house, I could do what I want because I had him as a role model. But many people that I talk to don't have that same experience around the early messaging around disability. And you can see it coming through in the chat, right?
Right.
But Christina,
I think one of the important things that you just pointed out, though, Anna, is that while you were fortunate enough to have somebody that was seen as a leader in your community with a disability, Sam Dardick, who was the founder of Freed Center for Independent Living, you said he was a wheelchair user. And we're going to get more into that as we go. But I think that that's a really important point, especially because we just talked about disability, meaning the wide variety of cross disability. And I love the chat feature and what we're getting in here. And it looks like a lot of people can relate because they had experienced disability, it looks like mostly through families and through friends. And I'm going to go to the second question. I love the interaction here. When the media covers disability, what are their typical themes? Oh, I love these answers. And Anna, you know, for me as a person who was born with my disability, now I have children that have also inherited my disability. Growing up with a disability with a teen mom who was also single is a very different experience. And we were very low income and we had a number of different challenges. So disability was only one of the many things that was going on. And definitely there was a pity for disability. There was a lack of understanding. I feel very fortunate that the cousin that was closest to my age, 7 months younger than me, was also born with a disability. My cousin Larry has Down syndrome. So I feel again, very lucky that both Larry and I grew up together and that even though his disability is intellectual developmental disability and mine is physical, there were still some things that we could very much relate to. We took the short bus together to school. We were in segregated school together. It was certainly something that was seen as not only something you should take pity on, but also something that my family was very sad about and something that my family felt like they were responsible for. So it was very, very negative. And I wasn't, unfortunately, like you. Growing up in San Diego, I didn't see any disabled people working, for one. And for two, when I did see people with disabilities, it was typically serving as panhandlers on the freeway or people in need constantly. So while my mom was a teen mother and my aunt was also a teen mother raising my cousin, there was really nothing that we didn't have like career goals or college goals or anything like that. It was like live day to day and make sure we can pay rent month to month is what it was for us. It wasn't really about disability. So some of the answers, media, go ahead, Anna.
Yeah, I just wanted to add that when I became disabled as a teenager, it was completely devastating to my family, to my friends, and to my community. And it was a lot of guilt for my parents, right? That somehow they allowed me to get this significant disability when I was a teenager and under the age of 18, and tremendous amount of guilt that lived with my family for years. I will also say that, you know, there's a lot of misconceptions. My family was sure that I would never work again because I was a paraplegic and disabled, and that I would actually need 24/7 assistance for the rest of my life. And I bring that up because that ended up being so far from reality, but that's what we see around disability. We know that when youth transition into adulthood and their disability benefits, they have like a 0.5% chance of ever getting into gainful employment and getting off of disability benefits. That means a life of poverty for people. And that was something that, because I had a positive role model, I was able to see beyond that and realize that I could get a job and that I wasn't going to need 24/7 care as well, right? At first, of course, when you're adjusting to a disability, it can be very difficult and you need additional assistance. But oftentimes, as you learn to live with a disability, you learn your new ways of doing things. So I just wanted to mention that.
Absolutely. And I think, looking at the chat and seeing all of the comments, people really understand the effects that media has on disability. And yeah, you're absolutely right, Anna, when it comes to the messaging and what we see in mainstream media, it's often inspirational, it's pity, it's condescending, it's all the things folks are typing into the chat. And it's like we're constantly in independent living and disability rights working up a hill to try to prevent that from continuing to occur and increase the positive part of disability, which is this is a natural part of human diversity. And even though people have different experiences based on when they acquire or are born with their disability, it's it's uniquely different for each individual. And what my grandmother experiences as a person with a disability is very much different than what I experience. And she's, grown up in a society where disability to her, even though she was very much a part of my life, and now I'm one of her care providers, she sees disability as very negative and not something that she wants to identify as. And I think that that's really important because that is the stigmatism and the messaging that goes out that makes people not want to identify and know that being disabled is a natural part of life. So I know, Anna, you want to say something and it's 10:23 and we're on slide 3, so we're in big trouble. But I very much appreciate all of the comments in the chat box. I want for people to do something. So in addition to what we learn through the media, what our first experiences are about disability, the stories we've heard about children saying, why does that person look like that? And, parents constantly grabbing their kid and saying, shh, be quiet, don't talk about that. And, makes all for uncomfortable situations when we'd really much rather them say hi and just talk to us. I want people to Google right now. So while we are working to get people to understand that disability is a natural part of life, that ableism is a thing, and that disability is inclusive of so many different things, not just wheelchair users, I want to point out what Google does when you put in disabled. So for those of you that have access to using your search engine right now, I'd like you to just put in the word disabled and see what you get. And type that into the chat as we move on, because again, it's another way society is continuing to perpetuate the stereotypes that we're trying hard to end in independent living and in the disability rights movement. Next slide.
So, and you can see, as you go ahead and Google, right, there is not only stereotypes and misconceptions about disability in general, but what disability means, right? So oftentimes when you do those Google searches, you will find a bunch of images of people in wheelchairs as if the only disability we're talking about is physical disability or someone who uses a wheelchair, which based on just the chat alone and looking at your responses, we have a lot of people with various types of disabilities on this webinar who know that they probably have examples of how they constantly are having to educate that disability is not just about physical disability and using wheelchairs.
Right. And we have somebody, Sarah Steenhausen, is pointing out that it's all about limitations when you Google. And yeah, exactly. And how can we change that to be about a natural part of life? The human experience includes disability. 9 times out of 10, if you live long enough, you're going to end up being a person with a disability. I mean, those are the things that we want Google to be putting out, to be normalizing disability and being able to uplift the diversity, the topic of diversity, to also be inclusive of disability. So I think this is a difficult question, but we have a very active group here today, so I'm excited. Are you ableist, listeners, participants? Are you ableist? And what is ableism? What do you think? And I just got done reading the book, White Privilege, and I was like thinking, you know, in terms of racism, I'm not racist. And then when I, oh my God, I need to check myself. So I'm just to see what people think about when we ask them, are you ableist? Not at all. Of course we are. I hope not. Yeah, I think it's difficult because ableism is somewhat of a new term. Not a lot of people use it. When we talk about isms, when we go into different diversity and intersectional type of conversations and trainings and workshops, disability is sometimes one of the topics that's forgotten or left out of the conversation. Next slide. All right, Anna.
Okay, so what is ableism? And so we're going to dive into this a little bit. Like Christina said, it's one of the many isms we've been talking a lot about. And I want to say that we've made a lot of progress. The fact that we're even talking about ableism and ageism, right, through our policy work at our organizations, I think is really a huge step, right?
Through a State Department.
I know. Kim McCoy-Wade, for example, every presentation I've seen her do around aging, around the master plan, she has incorporated ableism into it, because we have to be real that this is another form of discrimination against people with disabilities. And we see it play out in so many ways in our daily lives. And while we'll go into a little bit of our history, I just want to be real that while it has been worse maybe in the past around discrimination against people with disabilities, these are still issues that we are dealing with today. And I want to just give you a couple quick examples on that. Christina mentioned that in the Zoom world, it's probably the first time since I've become disabled that like people don't necessarily know, because I have a very obvious disability. Remember, there are some disabilities that are hidden. There are others that are more obvious. You wear on your shoulder like I do as someone who uses a wheelchair. So it's been really interesting to see kind of navigating the world without people knowing that you have a disability is really different. But when I go out in the community, still on a daily basis, I can give you examples. I can talk about when I went to this lovely little restaurant and this great older gentleman, very nice man, opened up the door for me as I was coming up to it. And he looked at me and he said, "It is so great to see you out of your house." And I just thought that was an interesting comment, because what I would give to stay home for a day. Well, I mean, with COVID, more than ever. But, you know, it was kind of assuming, right, that I don't get out much, right, which is really not the case. I can remember going to my doctor and having my doctor say, "Gosh, it must have been terrible when you learned that you could never have children." Luckily enough, I have gone to a spinal cord injury specialist clinic since I became injured, and I knew very well about my reproductive ability and how that is not impacted at all by a spinal cord injury, right? And thinking, how horrible would that be if I didn't know that and have my doctor tell me that I would never have children in that way, just because of ableism and assuming that I'm not able to do things that I can do. So Christina, do you have other examples here?
Yeah, I just want to point out that we've put some examples here on the slides: employment, rental housing, and parenthood, websites, video conferencing platforms, and consumer services. And we have a lot of people understanding what we mean by that and talking about internet access, which is great, because I think that's one that's often forgotten. To our visually impaired really are challenged in navigating online systems. And right now during COVID, you know, while we're facing a digital divide, we're also facing a situation that prior to COVID, people with disabilities couldn't even navigate the internet as it is, because while the laws are that websites do need to be accessible, and we're glad that California enforcing that specifically with more recent legislation. All websites are not created equally. And it's really important to bring in IT professionals that know what access is and to be able to make your websites accessible. But like Anna said, employment, I mean, that's something that we absolutely still face today. And the fact that rental assistance, I wanted to bring this one up because we had worked in collaboration with the Urban Institute in Washington, D.C. to do a study about 5 or so years ago at CFILC, where we created partners to do a housing survey where we had people that were wheelchair users and we had people that were able-bodied, and they had to look similar. So brown eyes, brown hair, one stood, one didn't stand, to go out and try to rent an apartment. And you can find the study still on the Urban Institute's website, but literally, as you could probably imagine, or maybe not, landlords were more likely when income is the same. We set it up so that the person was basically the same applicant, just one was a wheelchair user. The rental 8 out of 10 times always went to the person that was not disabled. And I know they did another study very similar with the deaf community where they sent someone who was deaf versus non-deaf. So, I mean, these are persistent discrimination acts that continue to really impact us individually and our systems in our world. And I'm sure a lot of you can think of others.
And I just want to point out, we do see one of the highest unemployment rates of any community in the disability community, as Christina's getting to. I just want to note, because there's been a lot of discussion on language and how ableist much of our language can be. And that, you know, they're often, you know, language, we can't go into this in this presentation, but language is super powerful and it helps create our world. And so you do see terms like handicapped used still today that really is, you know, not an empowering term. You see language like lame being used that basically is, you know, directly related to someone with a disability, right? So there's a lot of language we use, and we really need to rethink how we use language and to create, and whether we're using it in an empowering way or not, I guess is what I would say. Great comments too, by the way, on disability in media, right? How often is it the bad guy? How often is it the poor person, you know, that is just in a terrible situation as being portrayed as to how media portrays disability. Although we're seeing some different examples on that. I just want to point out.
Which is good.
Yeah.
And we're not going to have time to go into the different, what I call is the three-headed monster, but the different beliefs of disability and the images they portray. But Anna just reminded me that oftentimes, most often, you notice, and I don't know if you've all noticed, but the folks that end up winning the Oscars are folks that played some sort of disability role, like Forrest Gump, like more recent films. I'm totally drawing a blank on it, but it's always interesting to see how many actors and actresses playing a role of disability win the biggest awards. And there is definitely been a long time campaign to have Hollywood bring on actual people with disabilities to play those parts, not fakers. Next slide. All right, historical and current policies. So we're, you know, Anna and I are not lawyers. We just want to point out, because we are always amazed that people didn't know that these existed. And unfortunately, in some states and parts of the world still exist today. So in America, and sadly, this law started in Orange County, but the Ugly Law, which was about people with visible disabilities that had any type of deformities or appearing strange in public, were not able to come out of their homes because of the ugly laws that were passed in different states and around the country. Sterilization, which was again about creating a race without disability. And so if you were born with a disability, you were sterilized. People like me would have been sterilized. I wouldn't have my beautiful children. And again, that was creating the perfect race, and sterilization still exists. And I haven't checked to see if it passed this year, but I do want to point out that the sterilization laws are still in effect, aren't necessarily publicly occurring in the way that it used to be acceptable. Sterilization absolutely still happens today to people with disabilities, but I know that the law that California has on the books, DREDF, Disability Rights Education Defense Fund, has been working hard to get it off the books in California, because it does still exist here, or at least it did prior to this last ledge session. So I'm not sure if it came off or not, but especially for folks with intellectual and developmental disabilities, sterilization is still a big topic. And even folks that have mobility disabilities, and some friends of mine have told me about how their doctors have said they could remove their uterus if they want to end their periods and to make it easier for them, making assumptions about whether their reproductive organs should be used or not used, and parents making those decisions for their children before their children are of age to make that decision on their own. And then oftentimes people don't know that before the 90s, it was sometimes illegal for people with disabilities to fly. So if you were going to cause the airline to be behind in their schedule, or it was just too difficult to get you on and off the plane with your equipment, the Air Carrier Act is what allows us to be able to fly equally now with our non-disabled peers. But that law was just passed in the either late 80s or early 90s. I can't recall, but I can't believe that within my lifetime, people could not fly. And then there's institutionalization, which still happens today, but historically and in the beginning of time, for folks that are familiar with the disability timeline, the institutions that were first created were created as poorhouses for people with disabilities. And even in today's society, we are working to close down institutions. There are a wide variety of different types of institutions. So I have a variety of different documentaries I could point you to, but there's a very popular one that was just released out of Oregon, and the protection and advocacy up there had done a tremendous job in closing that down and getting people into the community, into their homes with the support that they need. And then we have the Olmstead decision that the Supreme Court ended up taking on, and is supposed to be, in theory, the way that we work towards ending the institutional bias and creating opportunities for people to get the services and supports to be in the community of their choice. I think we all know that that's not necessarily worked to its fullest yet, and there's a lot of reasons why. And California has an Olmstead committee. I think there's a lot of work to be done in this area, and I'm sure the committee would agree. But it's 2020, and we're still living in a society that prioritizes the institutional bias. So it's important to remember that as we move forward.
So we wanted to talk a little bit about the different models of disability. And we'll kind of go through these. I'll start with really looking at the charity model, right? Where the person with the disability is not an agent of their own life, but rather a recipient of care, cure, and protection. So give us a good example of the charity model, Christina, where we are these poor kids being paraded to raise funds for our poor lives, right?
Right. And everybody, I think, well, not everybody, because I have to say, I'm aging and I'm aging gracefully. And I love when I talk about the charity model now. And when I talk about the telethon, the Labor Day telethon, people now look at me and go, what? And that's how I know I'm getting older. So I love it. So I think we might have an audience of mixed ages, and some might know what the Labor Day telethons are and some might not. But Jerry Lewis's famous telethons that was all about pitting people specifically with muscular dystrophy and giving money to create a cure, and pitting the children, mostly he used children, not adults, to paint this very sad picture of these cute, beautiful children that he literally, quote, would say, these children will never amount to anything in our society. Give money.
Yep. Then under the medical model, really, and this has been kind of a long history of people seeing disability as a negative, right? As a personal problem, as that we need to cure them, right? We need to make them seem less disabled. And you really saw this, I hear this a lot from my friends that had contracted polio and were forced to wear leg braces for so many years because somehow it made them seem less disabled because they were upright. And then getting to an adult and being able to make their own decisions and throwing aside the leg braces and crutches and going to a wheelchair, where suddenly it was like liberating and so much more independent. And I see that even from friends of mine who have low vision, that as a kid they had so many surgery after surgery after surgery to try to correct the vision loss. And then finally, when they get to be adults, they realize, and can take control of their own lives, that they are able to embrace, right, the vision loss instead of in this perpetual trying to cure something that really they need to be able to figure out how to live with, right? And that in this model, professionals are the experts, right? So it's the doctors that know best, and they know what's best for you, and all about fixing the person.
And I think it's important to, again, point out that's why, as people with disabilities, as allies, as people that really want to change the system, we need to talk about disability as a part of diversity, being inclusive, that it is a natural part of the lifespan. That is, I think, one of the most important ways that we can continue to change what society has built up about disability. Here's another one, the model. And a lot of people are less familiar with this one, but this really goes to sub-minimum wages and paying people with disabilities less than minimum wage simply because they're disabled. And it's sad to say that California has some of the largest sub-minimum wage employers. One of them right near Sacramento, Pride Industries, that pays people based on their production and how many pieces of something you can put together or take apart in a specific amount of time. And I want to say there's many different sub-minimum wage employers, and there's a lot of controversy around people feeling like they should continue to exist versus not exist. And I would encourage any of you who are interested to learn more about that topic to watch the very wonderful documentary, very well done, Bottom Dollar, which looks at all the different types of people with disabilities. Again, it's a cross-disability issue of people being paid sub-minimum wage simply because of their disability. So being less valued economically. And then the social model of disability is that people are who they are, and that it's not us as disabled people that are the problem. It's society, it's the built environment. The contractors have a choice on how they make a building. And I'm just going to say mobility and actually websites as another really good example. IT people, building folks, they have an option of determining whether or not that building can be made with stairs or a ramp or an elevator. A website can either be made accessible or inaccessible. Those are options. This is not something that is about me not having access. It's about the environment not being accessible for everyone.
Thank you, Christina. And I want to add to the social model, and you said it before, but it's really important that it's part of diversity. Disability is part of the human experience, right? If you live long enough, you will experience disability. You might experience temporarily, maybe a broken leg. It may be a permanent disability. You may age into a disability, right? Or maybe it's a neighbor or a family member like we see in the chat. It's just like gender or race. It's part of the beautiful diversity that makes up our community. And see how that's different, right? Than some of that early messaging that we've heard around disability. We really see this as a beautiful thing that is so important to have in our community, just like all other diversity. It's not good or bad, it just is. And that we really should be the experts in our own lives, right? Instead of it being the professional. Now, doctors, in my case, fixed me and saved my life, put me back together after a horrific car accident. But they know nothing about what it's like to live every day with a disability, the choices that you're going to have to make, and the ways that you're going to have to modify your own life to make it work for you. That's a really individual piece that we're really the experts in, not someone else, not anyone else, really, frankly. And so, and as you said, the environment really is a problem, not us, right? And I think you put that really well, Christina. How about the human rights model?
And that's the newer model. The human rights, the social justice movement, that's really about us being able to have access to everything within our society and working towards making more inclusive environments, whether that be online or physically. And I think that we're going to touch next on how you can make that happen, and whether you're somebody who identifies as disabled here with us today or somebody who's an ally, there are ways that you can really change and work towards the human rights model with us. Next slide. So equity and accommodations. This is a really important one, and I really, really want to stress how important it is to understand this from the beginning of creating events, activities within your organization, your business, your state department. Access, like Anna said, is so powerful, but that there's also the other part of access and language, which is making sure that what you're creating is accessible to the widest audience. And so one of the examples that I use most often is when you're creating, let's say, a registration form for today's Zoom meeting. When you put in a question about access, like, do you want your materials in advance? Do you need captioning? Will you need American Sign Language? By you simply adding that question and creating an accessibility statement on your flyers and marketing materials is what makes folks with disabilities understand that this is for us too, that we're invited because you've thought about this from the beginning on how you're make your whatever it is inclusive of the widest population. So plain language, that's using language that is accessible to the average person, nothing more than a fifth grade reading level. Again, captioning, that's what we have here today on Zoom, the closed captioning where somebody is providing that text as we're speaking. And then American Sign Language for folks that need American Sign Language. And I want to be really purposeful in saying that just because you need American Sign Language doesn't mean that captioning is accessible for you. And just because you might use captioning doesn't mean that American Sign Language works for you. So it's not one or the other. It's really being intentional and asking people which one will be most accommodating for them to have an equitable experience. And then there are people with disabilities who identify and those that don't. And either way, the reality is people don't know what accommodations mean, for one. We can't assume that just because somebody has a visible or non-visible disability, whether they identify or not, that they know necessarily what accommodation will work for them. And while many of us do know, the fact of the matter is, again, depending on when you're acquiring that disability, you may not know. So I'm always preaching to, especially folks in my world, that be an accommodation ally. I mean, be somebody who can offer a suggestion. And if it works, it works. If it doesn't, it doesn't. But, you know, let's not ignore it, and let's set people up to be successful, not set people up to fail. Next slide. And here's a visual, again, because this is a PowerPoint, we want to be intentional in case we have visually impaired folks or blind folks on today's webinar. We have a photo of equity versus equality. And the equality photo shows a wall, which I can't stand as a short chair user. These walls where you can't see over to maybe see an animal at the zoo because the wall is too high, but everybody can equally get up to that wall. So that's equality. But the difference is that with equity, that same wall is there and they create a ramp for a chair user to be able to get and see over the fence that is in front of them, just like everybody else can. And so, there are other examples of equity and equality. This is a very easy visual for people to understand the difference. And that's why we chose to use it today. Next slide.
And so as we go into the next slide, I think, where does this play out around your organization and even the policy work that we're doing? I think there's a real opportunity with the master plan, with any policy or program development that we are working on, that we're being inclusive, right? And we're being inclusive to equity, to people from diverse backgrounds of all types, including those with disabilities. We know that the service structure for aging and disability often is very, very siloed, right? Yet we know that oftentimes people with disability and older adults have similar functional needs. We may be different places in our lives. There may be certain nuances, obviously, that are specific to people with disabilities or older adults, but many times the functional issues are very similar. So we kind of have an opportunity in our policy work to stop creating more silos. We all need accessible transportation. We all need accessible and affordable housing. We all need in-home personal assistant services. There are so many things that we all rely on. And I work for a disability really specific organization, right? To be eligible for services as an independent living center, you have to have a disability. Over 70% of those that we serve right now are older adults, right? Because we know as we age, there's a higher likelihood to acquire a disability as we age. And I know that when I'm working with individuals in their 70s or 80s, we'll often ask, well, what's your disability? But if we ask it in that way, I can't tell you how many times we've heard, oh, honey, I don't have a disability. I just am getting old. And she has a walker and hearing aids and can't drive anymore because of her eyesight deteriorating. So, there's a huge intersection between aging and disability. And so that really is going to be critical in our program development and policy work, that we're really inclusive. Christina?
Yeah, I just want to point out that, on the slide here, how we do better, we create intentional, inclusive policies and programs, just like Anna's saying. And, I have to say that I was really struck by the Scan Foundation's video from their conference a couple years ago, when they had interviewed folks with disabilities and older adults across the state, and how it is for them individually to navigate systems and the amount of hoops that folks have to jump through. And I think that, to me, that was, while I knew it and have experienced it myself, it was helpful to see that and have that reminder, because as we create policies and systems, we need to not think so much about the policies and systems and the structure, but the individuals that they are supposed to serve. So, having person-centered services is, I think, the way we need to think about creating programs as we move forward, and any policies for that matter. And I think that's why CFILC is such a supporter of creating no wrong door systems and aging and disability resource connections, because while we know that the likelihood of ending all silos between the aging and disability community is probably unlikely to happen in our time or ever, it is really important that we work together to really build more inclusive programs and services that get at what the person needs, not what the system was set up to do itself. I think that it's just super frustrating to know that folks that need so many different types of services have to go through 10 different systems to get it. And I think that that's something that we can collectively work to change by creating more inclusive policies and programs. And I just want to point out, like, while Honest Center, like she said, they're serving more people over the age of 60 than not. We did survey our independent living center members last year, and over 50% of our centers are serving people over the age of 60 more than under. Next slide.
So, Christina, I know we need to leave time for questions. So let's just, that we have a few minutes. So let's just open it up for questions here.
Absolutely, because this is the last slide, and these are just some resources for folks to take away. But yes, let's open it up for the last few minutes.
So what can the ageist movement learn from the ableism movement, Christina?
Say that again.
What can the ageist what can the ageist movement learn from the ableism movement?
Well, I think we have a lot to learn from each other. And I still haven't gotten over how ageist the presidential election was, but I think that there's a lot to be talked about in terms of language and grounding each other in our joint discriminations, because I don't know that both communities understand that while we face different experiences, we also have a lot of commonalities, and one of them is language. And just creating aging and disability resource centers as an example, we've been working on this for over a decade, and I'm so proud of where we are now, but we have so much more work to do. And creating those partnerships and understanding each other's language, really creating values that we can both work from, I think is really where we need to continue to start. And for those of you that are further along in that work, in that part of your process, I think it's about ensuring that you're meeting the needs of the people based on what they say is needed. And that is really about doing community surveys and assessments and not making those determinations based on what you think as providers people need.
Well, and it goes back to how you provide services too, as an example. So really embracing the consumer-driven type of service delivery model or person-centered type of philosophies for providing services, so that people really are in the driver's seat, and you're kind of doing it through an empowerment model rather than an us and them and we're the experts. And so it really creates a different dynamic. In the disability movement, we've really been seen as kind of outliers around that for many years, but now you see the value of that being incorporated into the healthcare systems, into aging, into developmental disability services. So how we provide services is one piece as well. There's a question here. How would you word a question for an elderly person that does not think they have a disability?
We, in our Digital Divide program, Digital Access Project, because we want to reach people who are older adults that might not identify, we ask something as simple as, do you have a walking problem? Do you have a hearing problem? Do you have a problem seeing? Because while those types of sentences kind of make me cringe, it is the way that the older adult community can identify as people with disabilities. And then we can have that conversation. Like if somebody hit yes, they have a hearing problem, then I know where to go in that conversation about maybe they need a pocket talker, or maybe they need hearing aids, or maybe they need, to know how to use their smartphone with the apps that allow the volume to go up louder than the typical phone. I mean, there's endless ways. And I know that's sort of a long answer to your question, but ask it again in the easiest way. That here's how I do it. If my Nana, who is 83 years old, can understand it, then I know I've said it well. So test it among the older adults that you're working with and see what resonates with them.
And ask questions, get people to open up and talk, because they may not say disability as an older adult, but they may very well describe difficulty with the walking and hearing and seeing.
Right.
This question, I just want to, because it's so relevant in so much of the work we do. It's around decorative treatment to pedestrian routes, creating access barriers. And that is so true. So it's really critical that we continue to advocate and work with our local cities and counties, public works and businesses and what have you to educate them on the importance of accessibility. I have literally dealt with a whole city saying they didn't want to put accessible parking on the main downtown street, because it wasn't aesthetically pleasing to have the blue signs. Okay, so we do still bump up into these issues around just blatant discrimination, misunderstanding, stereotype about disability and accessibility. So it's really important that we continue to educate. I know we are.
I think we're out of time. I'm not sure if Amanda can let us know if we are or not. I don't want to lose the captioner. But one thing that I didn't cover that I really want to make sure folks know is important too is make sure that the folks providing services and the folks that are in your organization that you're hiring also reflect the community that you're serving. So think about that and create, again, being intentional, create a plan, a diversity plan for when you have openings at your organization. How will you work to fill those to make them more diverse and more inclusive and reflective of the community you serve? Having folks that can be able to relate and look like the people coming in for services makes an incredible, incredible difference. And that is one of the highlights of independent living, again, is that I think the most important part of our work is that we are people with disabilities who are not only professionals in our industry and in the world, but that we can relate to the people that we serve. And that is so unique. It is so rare as people with disabilities to go into a social service agency and be served by people who look like us. It is so rare and so meaningful. And I can't tell you how many times when I did work in IL, people would come in and say, after booking an appointment with me over the phone, "Oh my God, you're disabled too. I had no idea." And it would be a different discussion than based on what they thought they were coming in for.
And with that, I want to thank you all for the work that you do. Remember, the one thing I guess I would ask is to think of disability as a diversity issue. Embrace it, welcome it. If you have questions and you don't know what to do, which is the case for many of us in different circumstances, ask. Just ask. Be respectful and be inclusive. And so with that, I want to thank you all for your time today. I know we're over time, so many good questions, but really appreciate you all for what you do. Thank you.
Thank you.
And thank you, Christina and Anna. You two have been absolutely valuable to as MPA partners, CDA partners. I'm going to go ahead and plug our upcoming webinars. And if it's possible, if you're able to stay on, we could answer a few more questions, but I do just want to make sure everyone knows that we have these upcoming webinars the next couple of months. You can register in advance. Next slide, please. And go ahead and check out CDA's equity and aging resources. We have plenty of good stuff online. I will go ahead and take the resources that Christina and Anna shared with us today. I'll share that out in our newsletter, and I can follow up with an email to everyone who has registered for today's webinar. Thank you again, everyone, for attending. Please take care of yourselves, take care of each other, and we hope to see you next month. And